So, kidney dissection is going to be pretty straightforward as far as the anatomy, direct anatomy of it. You're going to grab a kidney, you're going to do try and do a mid-sagittal section through it as close as possible. And then you're going to spread it out and identify and differentiate some of the regions. Now, one of the first things is see how here on the outer edge, the little renal capsule. It almost looks like a little bag that the kidney is in. So you should be able to identify that. After you do that, then you cut the kidney and you're going to identify some of these internal structures. So you can make out, see this kind of lighter area on the outside or the outer rim all the way around. Okay, that's the renal cortex. And then all this darker region in here is all your renal medulla. What is the renal medulla made of? Pyramids and columns. Nice little triangular pyramid and a column. Pyramid and a column.
So is the column where the blood vessels exit, or is it?
That's where you're going to find mostly your blood vessels. So we got pyramid, column, pyramid, column, pyramid, column, pyramid, column, pyramid, column. At the end of the pyramid, see the little flap? There's your papilla. And then right underneath the papilla, you have this kind of semi-darkened region right here. This is your network of minor calyces. So you can say your minor calyx. And then you see these little regions right here, the white areas. Those are your major calyces. Major calyx. Those funnel into this area here, which is the renal pelvis. And then the renal pelvis is going to attach to the ureter. That's it. Renal capsule, cortex, medulla, pyramids, columns, minor, major calyx, renal pelvis, and the ureter. That's all I expect you to identify directly on here. Now I said directly. That's important. Because I could point right here, for example. First question will say, what is it?
Pyramid.
Renal pyramid. Okay. What are the primary structures that you find in this area? To be specific.
The Luca Henley would be in them.
Yeah.
Okay. Of your juxtamedullary nephrons,
yeah.
But primarily this area, the pyramids are made of collecting ducts. Your pyramids are made of primarily of collecting ducts. Okay. What's the primary tissue of your collecting ducts? Simple cuboidal or simple columnar epithelium. What's the function of your collecting ducts?
Filter?
Not quite. To excrete the urine. Okay. It's filtrate until it leaves the distal convoluted tubules, meaning that once it enters your collecting ducts, it's now called urine. Okay.
Where's the distal tubule?
Distal convoluted tubules will be up here in the cortex where the nephrons are located. So that's another one. I point here and I have to say name this area. It's the cortex. Name 5 structures you find in the cortex. There's a lot. You could say the renal corpuscle. You could say proximal convoluted tubules, distal convoluted tubules. Okay, those are some things. What are the tissues that make up the tubules? What are the tissues that make up your renal corpuscle? What's the function of those structures? Shoot, there's one. 15 questions right there. Just in the cortex. Okay, so basically on the kidney, it's just identifying the structures. But don't just stop there. The important thing is to not just be able to identify this, but what would you find here? What would you find here? What's in here? Okay, and what's the purpose, or what's the tissue that makes up those structures? What's their function?
What is plugged in and out?
Well, yeah. Anyone know right offhand what specific blood vessels you find in the columns? That's something you'll work on soon.
Interlobar arteries?
Close. Interlobar. Interlobar arteries and veins. All right, so that's what you want to do this evening. You want to work on the slide and the kidney and then spend some time familiarizing yourself, getting comfortable with the anatomy of the urinary system.